Good morning, everyone. Today is Thursday, September 27th. Thank you so much for joining in to our weekly healthcare reform webinars. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. We've been running these webinars for over 5 years now, and I always say that I'm just amazed at the rapid changes that are coming in, especially under this administration. You know, it depends, I guess, from your perspective, if that's a good thing or a bad thing. But this is a place, hopefully, that you come every week to learn what's going on both on the federal level and on the state level, relative, you know, with legislation or bills relative to the under 65 health industry. So questions are encouraged. If you are new to this format, there are a couple ways you can ask those questions. You can click on the hand icon in the control panel to the right of your screen and raise your electronic hand to ask a question live. I'll unmute you at the end, or you can type in your question in the question box and I'll answer that at the end of the webinar as well. Periodically, I'll include some handouts in the webinar, and today I do have our Colonial Life and URL Jumpstart bonus. It is a way to really gain some more revenue, earn some extra income, and also really kind of look at your groups in a more holistic approach sort of way by filling in some of those gaps with voluntary products that really meet the specific needs of employees, not just you know, your traditional group life or disability. It's something that employees can choose, keeping in mind how they utilize their health plan. So we're going to just get started here just with a show of your electronic hands. If you could just let me know if you can hear me and see me, or see my screen. You can't see me. Excellent. Thanks, folks. All right, let's get right into it. Some of this is a review. So, of course, the last 2 weeks we had Phil Mishler, who is our Regional Sales Director for National General, on our webinar to kind of give us an update, a quick update about the short-term limited duration medical insurance. That, of course, will be available for sale on October 2nd, next week. And the earliest effective date you can sell is at 12:01 on October 3rd. So if you are looking to see how you can position your current clients, some of those clients, whether they're insured or not, may want to take a plan from 10/3 until the end of the year or until January 1st, and then purchase a 364-day plan on January 2nd through the end of the year. I always say please be mindful of these disclaimers because I think the insurance department is going to really try to monitor the sales of these short-term limited duration insurance policies very stringently to see if there are any infractions on how to sell and bundling programs, which was an issue in the past, or telling them that, you know, it's ACA compliant. So again, in capitals, please be mindful of the disclaimers. Some of my agent partners have even created kind of a checklist of some of the disclaimers from the insurance department's link, and they're going to have their clients sign off on that. And I don't think that's a bad idea. It talks about the coverage for no pre-existing, you know, prescription coverage, mental, nervous, maternity, all of those things. So it's a viable product, a commissionable product, but I want you to just not get yourselves in trouble. 2019 FFM Certification, of course, that's coming to good use, I guess, now with the marketplace opening on November 1st. AHIP and MLMS are the vendors. The ethics certification, that extra step that was required by Highmark and IBX in years past, is not. And there is an email going out. Highmark did create their training decks for the under 65 programs. It is highly encouraged to go through those programs, but it is not mandatory. So just, you know, remember that. House GOP Bill, Save America's Workers. It's retroactively going to delay the employer mandate penalty from 15 through 19. changing the full-time hours from 30 to 40, delaying of that god-awful Cadillac tax. And there are a few things not included in it. There's been no activity that I'm aware of on this bill, but I'll keep watching it. As I mentioned last week, on Monday, there was a hearing for the House Insurance Committee down in Harrisburg. I did attend that. Damian Mochin from PAHU, he's our president of PAHU, was there to give testimony, and a few other agents representing the IAMB were there as well. And Tobash's Bill 1605, I say it's more than likely not going to go anywhere. The bill was consumer access to insurance, and it talked about the ability to have agents charge a consultation fee when insurance carriers are not paying compensation. So again, that's something that a lot of folks really are interested in. But unfortunately, it just seemed that all of the testimony, although it was, talked about the revenue loss, the carriers, if they file the rates with the commissions, that they should be made to stick with that even through the special election period. But the general consensus was that the insurance carrier should be responsible for paying commissions, and that it could be a slippery slope on charging a consultation fee, who would regulate it, what the amount would be, what's considered reasonable. So again, I don't think it's going anywhere, but worth mentioning. And then House Bill 1003 was approved for a floor vote or out of committee. And essentially what that does is it mandates that the insurance carriers and CMS must pay the ambulance services, EMS services, even if a consumer refuses to have transportation. And then last but not least, 660-page bill to fight the opioid crisis was unveiled, both by the House and then Senate on Tuesday evening. And some of the provisions within that are that it kind of eases some of the restrictions for Medicaid to pay for in treatment or in care treatment. So, again, this is something that is prevalent nationally, and, hopefully we all understand the importance of this bill. Bill Mishler, our regional sales director for National General, he was gracious enough to be on the call both last week and the week before, but we are actually holding a more in-depth webinar on Friday, October 19th at 9 a.m. We're going to go over the site, how to quote, some of the pitfalls, everything you really need to know to feel confident in selling these products online. So hopefully you can join in. There was information, Independence Blue Cross had a data breach of 17,000 members. Independence Blue Cross will be notifying the affected members and offer to have access to 24 months of credit monitoring and identity theft protection. So keep watching for that. If your clients are asking, I guess no news is good news. If they don't receive a letter from Independence, then they are not identified as one of the affected entities. But as with everything, please just have your clients monitor if there's any issue. We've been through a number of these, and they always start out smaller and seem to encompass more members. And I'm not saying that's the case. I'm just saying that's kind of the experience that we've had, all of us, in some of these data breaches. So again, assure your clients that if they get a letter that they have an option to do 24 months of the monitoring, but if they don't get a letter, everyone should still be diligent. Capital Blue Cross Personal Blue to grandmothered individual family plans, they will be extended till the end of 2019. If you've seen those rates and the products, you're probably jumping up in your seats right now because they're great products and amazing rates. So if you have a client on these plans, chances are you should be encouraging them to stick with those plans. We talked about Highmark and the medical loss reimbursement rebate checks that are going out. They do have to be distributed in a certain way based on if it's employer paid or contributory. So be mindful of those rules. If you have any questions, let me know. We just figured out our own rebate check, so it's a bit of a clunky system. But again, if you have any questions on how your employer groups will be distributing those rebate checks, give me a call. Geisinger, new business commission change and rate reduction coming. So I cannot tell you what it is, but I can tell you that for November 1st through June 1st effective dates, there is a different new business commission than existing group commission, and it's a substantial increase. So I want you to be aware of it. I can't tell you what it is yet. It's not been officially released. There's also rate reductions coming for areas 3 and 6, which is Lehigh Valley, the NEPA and NEPA territory, and like Center County. So those are all, you know, big areas, and they're going to have rate reductions, and they can be anywhere from 5 to 20% off their current rate. So again, watch for this information. You will be excited because it's a real opportunity to earn some extra revenue and, you know, just do the right thing for your client. Don't forget the URL and Colonial Life bonus. It's attached, as I mentioned, and that brings us up to the end of the webinar for today. We'll open it up for any questions or discussion. Just be mindful of next Thursday, October 6th. I will be right back here, hopefully talking with all of you fine folks again and answering your questions. So let's see who we have asking questions. We do have some questions here. Actually, we don't have any questions. We had one comment, and that is about it. So I always appreciate you joining in. If you have any questions off cycle, please just contact me, extension 113-800-926-8875, or my email, debw@urlinsgroup.com. As always, I truly appreciate you taking time out of your busy schedule. It's, you know, fourth quarter, it's upon us. So I do appreciate you, again, being that resource for your clients and taking the time to do that. I think it's hugely important. And if your clients ever need a testimony on your commitment to knowing what's going on, I'm happy to provide that for you as well. So until then, until next week, I wish you all a great balance of the week and a wonderful weekend. Bye-bye.